Today's episode, I have Farah Meghji and Marsiglio from
Unum Co.
Thank you. Do you want to, before I ask both of you to introduce yourselves, do you want to tell us what Unum means?
Sure. Unum is a
Unum.
Latin word that means togetherness or connected. And yeah, I think that's about it.
Yeah, that's a good explanation. I'm never going to get it right. Unum.
Unum, that's okay. When we first discovered the word, we weren't fully sure of how to pronounce it either. But I mean, now that we say it multiple times a day, we understand the pronunciation.
And so, Megan, do you want to start and give us background, like where are you coming from? What's your experience? Why are you doing the work that you do?
Sure, yeah. So going back, in my undergrad, I studied applied science, specifically gerontology. I was hoping to go into recreational therapy at long-term care facilities, but then after I finished, I realized that I didn't want to do a master's in OT, and I stumbled upon PR. And in university, so it's kind of jumbling together my two backgrounds here, but in university, in my first year, I got diagnosed with Crohn's disease. And it took 2 years to get a diagnosis. And because of that length of time, I became really passionate about advocacy and the importance of advocating for yourself, because during the time of trying to figure out a diagnosis, my family and I, because I was like under 18 during that time, we really had to work together to get to see the right specialists, get that diagnosis. And if we didn't advocate for my health, I think that it would have taken a lot longer to receive a diagnosis. So I got diagnosed with Crohn's. I'm in university, really into advocacy. Then fast forward, I have graduated. I'm now looking at a new career path, which is PR and communications. I do that, and I stumble upon healthcare PR. And I get really interested in healthcare public affairs and public relations. So I did a little bit of work in the public affairs space, worked with some patient organizations, and I kind of went about different industries in communications and landed in my own business. And I did some healthcare PR through that. And all the while, I was still doing patient advocacy work with my blog, The Gut Gazette, destigmatizing digestive health issues, working as a patient partner on various projects in the digestive health space. And that's where I ended up meeting Farah, who was at a pharmaceutical company at the time. They were looking to engage with a patient who had a lived experience with IBD, because they're in the IBD space. And I went and spoke at one of their meetings, and Farah and I just hit it off. And we became friends. And every time we connected, whether it was for coffee or for lunch, our conversations always ended up in the patient advocacy space and how we need to make change and what that looks like. And from there, Unum Co is born. My long, convoluted answer to that. But to long story short, my background was in patient advocacy for my own personal experience, working in patient public affairs, which merged together to create Unum Co.
Nice. And Farah?
Yeah. Well, first, thanks for having us, Sabrina. We're really excited for this conversation. So yeah, Megan really recapped nicely the circumstances under which Unum was born. I've spent most of my career working in life sciences, both at a local Canadian level as well as globally. And primarily the work I was doing was in the patient experience and patient advocacy space. I've done some work in sales and marketing as well, but patient experience and engagement really was ignited this passion inside of me. And I think combined with, my experience being also a first generation born in this country, like South Asian, and seeing family members of mine experience the healthcare system, with English as a second language, not knowing how to navigate things, feeling always like we didn't see ourselves reflected in and represented in the system. So I think those things really combined to create this passion and this feeling inside of me that, the more we can integrate patient voices and experiences, not just in drug development or in medicine development, but in every aspect of how we manage our health care, not just if you have a chronic illness or a rare condition, but I think there's so much about patient centricity and patient engagement that is so relevant for everyone, for every person, for the people we care for the care we want to receive ourselves. That's really kind of what drives me, and what my background is leading me to Unum.
And it's, you're bringing up the patient centricity, which is what we're going to talk about today. But what I find really intriguing is your titles are patient-centric designers. And like, what does that mean?
Yeah, great question. And I have to credit a lot of this to Megan also, because I think that, I from the life sciences perspective and background where titles I think are probably as non-creative as they come. But when we really started talking about Unum and the work we wanted to do around helping organizations think about how they want to be patient-centric and embed patient centricity into their ways of working, across every facet of an organization, it really, I think, paralleled how designers, or if you're thinking about how to change a space, how to change a work environment, how to change a landscape, you're designing what that can look like and really bringing those creative elements to it. So that's part of why we came up with patient-centric designers. And maybe Megan, I don't know if you want to add anything to that.
Yeah, I think you explained that really well, but I will add that when we look at projects and working with clients on patient-centric solutions, we want to really bring out the beauty of the patient. We want to put patients as the influencers to really design and create these, beautiful solutions, or I guess solutions is the word, but that's why we chose design, because we want to create beautiful work in what we're doing. And patients have a beautiful voice. They have voices that we should all listen to and hear. And we kind of want to reimagine what that looks like.
And there's, also Sabrina, there's not one way to do patient centricity, right? There's many different ways, and many of those ways haven't even appeared yet, right? They haven't even come into being yet. So I think we're also trying to take this approach that when we work with clients on patient-centric programs and solutions, like Megan was saying, we really start from the patient, and we don't kind of force fit existing solutions into that program. We really look at inspiration from other areas, other spaces, other industries, to really bring some of those elements into this space.
Yeah. So like bringing that creative approach to the whole patient centricity discussion.
Exactly.
Yeah. And so like why this, why now?
Yeah, we saw a need for it. We saw that, yes, people are including patients in discussions and in the processes of developing solutions and products, but we noticed that they're not always integrating the patient voice or patient voices at the right time. And we are coming into this working with clients by integrating patients right from the get-go of their conversations and introducing them to patients before they even have those conversations, have those discussions. It's really important for companies and organizations to be speaking to patients all the time, not just one-off. And that's really why we came into this.
Yeah, I just wanted to answer your question, Sabrina, on maybe why now. And I think we feel things changing externally, right? We feel like there is there's this desire to work with patients, to talk to patients. There's like this inherent desire to do that. I think patient centricity is this like maybe intangible concept sometimes that organizations can get behind theoretically, like, oh, we're about the patient, we're creating programs for patients, we're building products for patients. But then when it comes down to how do we actually do that in a patient-centric way, I think that's where we struggle sometimes with what does the how look like? And we see externally how organizations like regulators, like funding bodies within countries are really starting to think about patient voices and what does that lived experience bring to conversations about healthcare services, about healthcare delivery and products. So we really feel like the tide is turning in terms of this is starting to happen. So we really felt kind of compelled to do this now when we can be creative, where we have almost that willingness, I think, from people to start to think about this differently.
So you did talk about like integrating the patient and the patient voice at the right time. And I'm just trying to think because like I feel like we get lost in the patient centricity conversation about what that means exactly. And so, is integrating the patient voice sufficient to be patient centric? And like let's say integrating the patient voice at the right time, is that sufficient to be patient centric?
I think that's where you start. But I don't think that that's enough. And I think about patient centricity in two ways. I think about it first as, within an organization, like culturally, do you feel like employees, like the people within your organization, feel connected to what they're doing? Do they feel connected to patients? Are they exposed to people who are benefiting from the programs, services, products that they're creating or that they work with? So there's a cultural element to being patient-centric. But then there's actually the patient centricity in practice and in ways of working, which you highlighted, Sabrina, that it's about integrating patient voices, yes, and accessing those insights to build better programs and services. It means also, I think, continuously asking questions, continuously engaging in conversations with patients, not to validate or create echo chambers to what you already know to make sure you're doing things right, but also to seek out those voices that are not always aligned with what you're doing and why you're doing it. So I think that there's so much more that goes into patient centricity that considers, representative voices, diversity of patient experiences, thinking about, building something, asking for feedback, and then going back and ensuring that you're responding to voices that perhaps differ from those that you're used to hearing from. It's about, being, and I understand, we talk about patients first and then product, patient then product. I think a lot of organizations have to think about product first and then patient. And so that's not always realistic, but it's really about, continual engagement. It's about diverse and representative engagement and collaboration. And it's also about, I think what we're trying to do at Unum too is really flip the model a little bit on engagement, where we're trying not to wait for people or organizations to say, okay, we're ready to engage patients now. It's really about, we are building a community of patients and we've engaged with patients and we know that they're already having conversations. So how can we bring those organizations into the existing conversations with patients? Because conversations aren't starting with healthcare organizations, right? They're already happening. It's about integrating organizations into those existing conversations. I know I've rambled maybe about that, but Megan, I wanted to also just throw it back to you to see if there's anything you wanted to add on that.
I think we really highlighted everything there. I think that what I would add is that organizations also have to include patient voices and patient experiences in a specific way. And when we work with clients at Unum, we're bringing these conversations and we are meeting patients where they're most comfortable. So there's a specific way of discussing and having conversations with patients. It might not be this traditional way of speaking to them, or speaking to people who are patients. But yeah,
people are talking about patient centricity, or organizations are talking about patient centricity, and maybe they're not really following through, or they think that they're following through on the patient centricity because they're talking to patients, or whatever it is that they're doing. But then how do you actually build like patient centricity into the organizations that I guess would be your clients?
Yeah. So I think it can look different depending on the organization. That's the first thing. I think it's about, how do we help groups within organizations access patient experiences and insights to do and deliver on their work in a different, better way. So even groups, for example, who historically don't work with patients, right? Because within any given organization, not everybody is directly facing patients every day. In fact, very few people within an organization interact with patients on a regular basis. So how do we make those insights and experiences accessible for everyone within an organization? I think that's the first thing that we help organizations do. And then the second is, okay, really asking the right questions around, if this is what I'm delivering on, how do patient insights and experiences, how could accessing those things change what I'm doing? Enhance what I'm doing, help me think of creative ideas. And also, so I think that's, if we're just accessing patient insights and experiences, when we actually work with companies to help them, for example, create patient councils or introduce them to patients that they can actually work with and have conversations with on a daily basis, then you can actually move to co-development with patients, where then you're sitting in a room with patients to ask them questions about what you're trying to achieve, the program you're trying to build, and get actually at some of those deeper challenges that patients face every day, and test solutions, right? And create new solutions to things that perhaps we hadn't thought about if we were not directly speaking to patients.
Yeah. Okay. So do you think that patient-centered and patient-centric is the same thing?
I think that patient-centric and patient-centered are seemingly the same thing in industry, but I also think that they are their own. So patient-centric is really owning that involvement of co-creation, patient involvement, patient engagement. It's changing the way that your organization operates. You are patient-centric. When something's patient-centered, it's kind of just revolving around the patient, in that I think everything in healthcare is patient-centered in a sense, because the patient is the end customer in every regard in healthcare, or with every regard in healthcare, but they might not be patient-centric. They might not be patient-centric in how they're involving patients, involving them in the room, but also even just removing the term patient in general. Like, patients are people. We are patients, we are people. And if we can understand that there's so many aspects to a patient, not just how their outcomes are with medication or how they feel at the end of the day, like what other factors affect patients? That would be my answer. So no,
So
they're not the same, but a lot of industry believes that they are interchangeable.
Yeah. So I had the same discussion yesterday with another colleague about patient-centered and patient-centric, and I agree. I don't think that that is the same. And you're right, like healthcare is technically patient-centered. And so do you think that that is what's causing the confusion around, like, organizations think that they are patient-centric, but it's because they're patient-centered?
Yeah, I'm just gonna jump in here quickly. Yes, I think that there's no rule book or playbook or even guidelines for how organizations should involve patients. And that's where Unum Co comes in, is we're going and speaking to organizations, we're looking at how they're currently doing things. And then from that, we're kind of categorizing them on this Unum scale of patient centricity. And it's not a report card saying that this is what you're doing bad, but it's saying this is where you need to improve. This is where you can improve. And if an organization doesn't realize that there is a different way to go about working with patients within this term patient centricity, then they're not going to understand. So that's where we really want to make change, is having an understanding across the landscape of healthcare, not just in organizations, but with healthcare practitioners, and patients understanding their rights as well, that there is the right way of doing things, and there is a way that you can improve how programs and products and services are positioned as patient-centric.
Yeah. And so I feel like a lot of the comeback that we've heard, and maybe not as much anymore, but previously, like when I first started in patient advocacy, it was a lot like, yeah, but the patients don't understand. Like, they don't understand the research, they don't understand the clinical trials. So, like, I mean, I have always been an advocate for, especially in the drug development, like if you're asking the patients right at the start, like before you start, then you're more likely to have a successful drug that will, and in the Canadian market, especially, be approved and reimbursed. So how do we get to a place where, like, how do we eliminate that barrier of involving the patients because others are thinking that they don't understand?
Yeah, I think, Sabrina, you raise such a fascinating piece to this. I think that in healthcare, um, a lot of, like, historically, healthcare providers, healthcare organizations have felt that because patients are sick, because patients are, unwell, that we need to make decisions for patients, because
Mhm.
patients, and then over time, that has come to equate itself with, well, they're sick and they don't understand, and patients, there's this hierarchy, right? So through that process and through that belief, we've taken the power away from patients, not because patients haven't demonstrated that they are sick and unwell and not informed, but because we've created these beliefs, and then we've taken these beliefs and actually acted on them without patient involvement. So I think that over time, we've left patients without opportunity to participate. And there are, and I do think, though, just to add to this, there is a health equity piece that is really relevant to patient centricity. So I don't want to ignore that piece. However, like Megan was saying, patients are people, right? We are diverse. We are more than just our diagnosis. We are teachers and physicians and nurses and educators and lawyers and server and all of those things and everything in between, right? So I think that people, and I always think about how, I worked in so many different disease areas when I was working in the life sciences space, and every single disease area felt like there was a stigma that they had to overcome in order to feel like they were making impact, right? For example, like there's a stigma with lung cancer, there's a stigma with skin cancer, there's a stigma with COPD, with every disease there's a stigma, with obesity, for example. But I think the overarching pervasive stigma is that we think patients are not capable. And that has really pervaded the whole healthcare landscape to the point where this lack of capability and capacity has now resulted in patients, in decisions having to be made on behalf of patients. And that's where we really feel strongly that we have to give that power back to people so that collectively we can make better decisions. We can engage in a more collaborative, sustainable way, because we all recognize, I think, that the system as it exists today is not serving anybody. It's not serving providers, and it's not serving people.
Yeah, it's not serving the government either.
Right.
I mean, there are some amazing doctors that do treat their people as people. And
Yeah,
I think
for sure.
your point too, Farah, with the stigmas in industry, they end up being transferred to the patient, that the patient taking in that stigma and then thinking like, yeah, they really are just a patient kind of thing. And then giving the word or the term patient a negative connotation to it, where patient does not have to be negative. It's just a term, right? And that's another thing we really want to do at Unum Co is to reinvent what patient means. It doesn't have to have any negative connotation to it. It's and people don't have to have any identity with it either.
I really like that, because in the last few years, there's been, I don't want to say a trend, but like a shift in, like, so we no longer say a patient or a cancer patient.
Yes.
It's a person living with cancer now. But
Yeah.
so I really think that, like, taking away that patient identity and redefining it so that, like, it's fine to be a patient. We're all patients. We all have some sort of issue, and, maybe it's not something that's chronic, but we've all had to be in a doctor's office at some point for something. And so we've all been patients, and it doesn't have to be a negative connotation. We can be patients, as you said, Farah, patients who are also engineers or lawyers or whatever it is that they are.
Fathers,
Yeah.
Yeah,
But
you can be a patient you are a patient at a dentist's office. You can be a patient with physio. You are a patient with physio.
Yeah, but Yeah, and it's interesting because that's actually my background,
Oh,
not
okay.
physio, but athletic therapy.
Mhm.
And it's when you go to a clinic, it's not a patient, it's a client.
Right.
Right. Yes.
Yeah,
Yeah. And
but
some dentist offices call them clients as well, or
clients.
call
Yeah,
people clients, which I really like that term. Because it sounds, I mean, as much as we're trying to remove that stigma of like a negative connotation with patient, uh, client does seem more positive because people don't associate like,
yeah.
yeah,
Well,
negative.
I feel like it's more transactional, so
Yeah,
I don't
totally.
really like it, but
That's
um,
true.
Far, you were talking about like the whole concept of um the information, like the information being like the patients don't understand the information, but I feel like now with all the technology that is available, there's a lot of misinformation that's being passed on. And so how do we like because I feel like that could be another barrier where people are going to say, well, the patients just don't understand.
Hmm.
So how do we like not use that, like this misinformation that's happening with technology now? How do we not allow that to be a barrier?
Yeah, it's a great question. And I don't know that there is one solution to that. I do know that part of the way to kind of combat the prevalence of misinformation is to really focus on empowering and engaging experts and credible, reliable experts like healthcare providers with the tools to create content,
Yeah.
and to drive conversations and to engage in conversations with patients. I think there will always be misinformation that is out in spaces, in social spaces, online, and I don't think that, I'm less about, hey, we need to take down credible information or misinformation and try to like squash it. I think it's really, how can we shine a light on information that is being delivered by experts, by credible individuals, and really helping to give them the right tools and time and space to deliver that content in a variety of forms.
Yeah.
And that's also, something that Unum is really helping to do, is how can we support providers who want to have a voice, whether that's through video content, through written content. How do we start to lift up those voices, and draw attention to them, so that we're almost like directing people to those people. And also, I think, Sabrina, there are so many. I think the number is like 6 million Canadians living without a family physician in this country. I mean, the shock value of that is significant. So I think it's even more important to be able to foster dialogue for those people who don't have access to providers, to give them access to content that is reliable, credible, safe, so that they can, ask questions and be
Mhm.
presented with information that is accurate.
Yeah.
Hmm.
And
Yeah,
it can be
providing.
patient experts too. Sorry, go ahead,
That's
Megan.
Oh,
right.
I was gonna say, like, providing education to patients, to people on how to read or listen to information to understand if it is the right information, or like how to weed it out. And actually, Farah and I were at a really cool event a few weeks ago with YouTube. It was YouTube and CAMH on understanding this this era of misinformation, and how YouTube Health has a really cool platform in that they have verified clinicians putting out information on YouTube that is real, that is right, and that people can watch and listen to, knowing that this information is credible, that it's coming from a credible source. So I think that's really cool in this in so with social media, to have these verified, credible resources that people can get their information from, and just understanding that, okay, if it's if it's from a source that isn't a doctor per se, and you're just hearing it from some person on TikTok, it's probably not right.
Yeah.
Yeah. And Sabrina, you brought up a great point, which is about patient experts too, right? I
Yeah.
think that credible, authoritative information doesn't, like, yes, it could come from providers and it can come from other places, right? It can come from patient experts. Like, we've met so many. I mean, I feel like Megan is a patient expert in so many ways when it comes to digestive health
Yeah.
conditions and issues. And so, I was also at a menopause event recently, which I feel is, such a trending topic now as well. But the average, I think a physician quoted that the average medical training medical residents receive on menopause while in medical school totals 1 hour. Okay, totals 1 hour. So
Is
you
that
ask
on menopause or on women's
Menopause.
health?
on
Just
menopause specifically.
Menopause.
Okay.
But I'm sure women's health is not far behind that.
Yeah.
And it just made me think about, well, how many women are experts through their lived experiences and through the information and knowledge that they have received and that they have sought out on some of these conditions that actually amounts to more information than our healthcare providers, right? I think that
Yeah.
people are bombarded in so many ways with so much information that, you know, we have to start giving credibility and focus and shining a light on people as experts and on lived experiences, and I think also on the innovation that comes from that experience and that information, because there are so many ideas and great sparks of innovation that come from people who have interacted with systems and with technology that we haven't thought about yet.
Yeah, that's a great point. And I'm going to ask you a question that I promise not to forget. But just to go back to the menopause, there's a very well-known Quebec, I guess she's kind of a celebrity. She's on TV, and she's got a talk show and I think also a radio show. But she just did, I think, like a 5-part documentary because she is going through menopause and she wasn't really understanding and nobody was really giving her any information. So she created this 5-part documentary on menopause, which I think is really a little like mind-boggling because it's 2024 and the only way to get the information is, through other people who have gone through it. So
Yeah, I love that
but
it's trending right now. It's just
yeah,
it's so empowering. And like I think you told me, Farah, that, and I had no idea about this, but menopause is just one day. It's like when people say they're going through menopause, it's like we're not even using the term correctly. You're going through perimenopause and then you get to menopause, which is one day, and then that's done. Then it's postmenopause. So it's just
Yeah.
even like, yeah, isn't that crazy?
Crazy.
oh, see, I didn't know that. I thought like you had to not have a menstrual cycle for a year to then be considered menopausal.
So apparently that's premenopause. Like, you're in premenopause when you have irregular periods, when the space, but then when you get to that point where you haven't had a period in a year, you just went through menopause. And now
So
you're
like it's just a
postmenopausal.
one day, like the whole year you're premenopause and then
Yeah.
You're just,
okay,
yeah.
that's very
Isn't that
interesting.
crazy?
Who came up with that? Definitely not a woman or a patient.
Well, exactly, right?
You
But
know, and
the whole life stage can last 10 to 15 years in its
Yeah,
entirety, right? Which is
yeah,
also crazy.
yeah, and yeah,
premenopause.
and I wasn't saying that to correct what you said, Sabrina, because I literally just learned that. I just think it's so interesting that, probably the majority of the population isn't even using the term correctly, like because we
Yeah,
don't know, we're not aware, we're not educated. It's probably
yeah,
something we should have learned in high school as well.
yeah. But then it also goes back to what we were talking about, the patients not being informed. But I mean, I think like in this case, it's also the clinicians who are not informed. But if you were having that discussion with women, like on this topic specifically, if you're having that conversation with women, then it would probably look a lot different than how it is described or defined right now. So that's also really interesting. But just to go back to the comments that you were making before, are we ready for this kind of innovation?
Yes.
Okay, tell me why.
Because I don't think that there's ever going to be a time when we are fully ready. It's like anything in life. You're never fully ready for something. I think if we want to make change and we want to shift the way that people are including patients, speaking with patients, it has to be right now. We can't, as Sue Robbins says, we can't have our ducks in a row. We can't get everything perfectly in order before we make change. So yes, I think that right now is the time. And I get so excited about it because why not? Let's work together. Farah and I aren't doing it alone at Unum. We're speaking and engaging with so many other individuals like you, Sabrina, to make this change, to get things rolling.
Yeah.
And yeah, there's never the perfect moment.
And I guess, like, is the status quo serving us right now? Right? I mean,
No.
yeah, exactly. So is this, are we ready for this? I don't know. Some days I think we're not ready for it, but it needs to be here, right? It needs to happen because the way we're doing things right now, I think we can all agree is not optimal.
No, we will never, if there was a perfect time, there will never be a time to start then. Like if we're waiting for that, because yeah, we're just hearing the issues and the problems and dwelling on them, and like let's just stop highlighting what's wrong and just working to figure out how we can make the change and taking actionable steps.
Yeah, and so I'm thinking like we're like in a generational shift as well. And so how do we get like healthcare providers who are from a different mindset? How do we get them on board? And not just the healthcare providers, but like the people who are making the decisions and the policies, and how do we get them on board? And I mean, if I think about life sciences, I mean, I agree. Like the time is now, but I feel like they would also be very resistant to changing the way that they're doing things. So how do we get that stakeholder buy-in? Or how do we get them engaged to be like, oh yeah, you're right, that we're not doing patient centricity the right way, and we need to rethink this. Or we're not doing patient
It is a
centricity
lot
well.
of education. I think it's collecting patients to use their voice, which is what we're doing a lot of, uh, educating patients to be the voice to make the change, because if they hear it from the actual patient, then maybe they will make the change and see that, okay, yeah, this needs to be done. I think doing the work with a variety of different organizations and being able to show those case studies will help. But just to your point, I want to go back. I don't think I'm answering this specific question, but you were saying like, how do we, with the whole generational shift and like the new generation and stuff, how do we get into those minds? Farah and I talked about this a couple weeks ago, but it's like we almost need to be educating people before they even make the decision to get into healthcare. Educating people in school and high school, this is what needs to be done. This is how you need to act and think, even if they don't even have an idea of what they want to do. Like we need to get into the minds of young people, I think. I don't know. It's an interesting that's an interesting conversation of how are we going to shift that, because there's definitely clinicians and healthcare industry professionals who are coming into the industry with a fresh perspective, are excited to change the way that the industry is currently working. And we see those people, right? They're really making waves. But then there's people that are coming into the industry who might have a mentor who's doing it in a specific way, and they're following their practice or their mentality. So I think it's just like everything in life, right? It's not, it doesn't, we can relate this to any industry. It's however you're going to come into it. Like I could even look at it in, any lens.
I mean, I think, Sabrina, we have to start. And sometimes the first is really hard to do. But I think that we can already acknowledge and clearly state the problems, right? I mean, patients aren't being engaged in the development of healthcare solutions, even though all of these solutions are intended to benefit us all. So how do we do this differently? How do we do this better? And so how can we, it takes like one person and then another person. I don't think that, everybody is going to get on board at one time. But I think that if we wait for that, we're going to be waiting for a very long time. And sometimes I think there already are so many individuals, like Megan was saying, who are motivated, who are excited about what patient engagement can look like, and how we can reimagine what this is. So how do we already start to engage and work with those people to then start to build some momentum around this? I think, there are lots of voices that are already doing this great work, and who already see the value and the benefit of this, because I think we've all seen the evidence that working with patients and involving them early on in the development of healthcare solutions leads to better outcomes, faster clinical trial recruitment, for example, right? Programs and services being launched in a more timely way. It saves money, it saves time. The evidence exists already. So we should already feel like we don't have to convince anybody that this is the way forward. We just need to start doing this.
Yeah. And you talked about like not everybody's going to get on board at the same time. So who are the first groups you start with?
No, I think that it does. It ends with patients. It starts with patients. Patients are really the center for everything in healthcare.
And so who needs to be involved then? So like, is it just about like co-creating with the patients, or do you need to have different stakeholders in the room as well?
Yeah, I think you need to have different stakeholders for sure. If you think about the healthcare landscape, and Sabrina, so interested in your perspective on this too, right? Because there's not just patients and providers, right? There are, like we were talking about, there are life science organizations, there are health technology companies that are building solutions for patients, that are maybe not doing it with patients. There are funding bodies, there are regulators. This is so multidimensional, I think, that I think there's space for everybody at this table.
Yeah.
And that is, that is, I think, the most important piece of this, that this is inclusive, this is diverse, this is representative, like this kind of work. Curious about your take on it though.
Yeah, so I think like I'm just thinking if I was a regulator, or maybe my perspective as a patient advocate thinking about the regulators is a better way to say it, is I don't know that they necessarily agree that they need to be more patient-centric. Like they engage with patients or they involve patients, whatever they like to call it, but so maybe I wouldn't even say that their approach is patient-centered, but, they engage and they involve patients, but it's not patient-centric. And if it was patient-centric, they would do their evaluations in a completely different way than how they're doing them now. So I think from my perspective, like, I don't think we could get to a place where we have a patient-centric healthcare system unless it's being co-created with the patients, but also like everybody is involved in that co-creation.
You want to just include people who are ready for it, who are excited about it and want to make the change, because it's going to be a lot easier to include those people instead of trying to change the mindsets of people that aren't ready for it.
Yeah.
And
And then,
hopefully that will gain momentum and show the people that weren't ready for it that, yes, this is the way that we need to go.
yeah. And I mean, I do think there's probably some education that needs to happen. So like I said, like, I don't know that the regulators or HTA are thinking about patient centricity, but if you like have that conversation or you do the education with maybe one person who's like, oh yeah, you're right. And then, it's just like you
Yeah,
said, a momentum that a ball starts rolling and
yeah.
the change of thinking starts happening with that one person. Oh yeah, I wanted to ask, do you have any examples of great work that's being done in this space?
Yes. I mean, I think I was going to say, I mean, it took me a few moments to say yes, but I think that there is so much great work that's being done in this space. I don't think that we're talking about, something that nobody's ever heard of before, and that is so novel. And I think there's so many great examples of organizations that are doing this great work. And so, for example, Megan talked about YouTube creating ways for, to highlight healthcare providers and create authoritative, credible content online to tackle this problem of misinformation. We know so many hospitals and healthcare organizations that have started to bring patient councils on board, patient and family advisors. We've seen, life sciences companies really start to engage in a more thoughtful and meaningful way with patient communities, and not just think about, what does not just think about doing patient engagement from a tokenistic perspective. I think there's so many ways in which this is happening already. I think that it is it is getting started, and it is happening, I'd say, inconsistently and perhaps not in the way that we would all like to see it. But I think that's because people don't always know how to do it. They're bought into the concept of it. I think it's just how do we start to do it in a more, holistic, meaningful way and can consistently, and then talk about, I mean, I will just say that I think the thing that's missing right now from organizations doing this kind of work is the measurement of the impact that it's having. Because I think we can talk about anecdotal examples of hospitals or clinics or companies that are doing this well. The measurement piece of this and the impact it's delivering is sometimes not as clear. So how can healthcare organizations measure the impact they're having in a really clear and compelling way? Because that's what's been missing from this work, I think.
And how can they do that? Do you have an answer for that?
Yeah, I mean, I think you need to think about what's the change you're trying to create, right? What is, and you're only going to know that and be able to answer that question if you talk to patients. Because otherwise, for example, the hospitals can theoretically get more funding if we demonstrate the impact the services are having on people. Companies will create better products and medications if we truly are measuring what the impact of those medications on people is having, not just the dollars of drug that we're selling, also the impact we're having, the value we're creating by bringing these medicines to the market. I think, how do we get really specific on what those impact measures are?
Yeah, and it's not just about, it's like the value that you're bringing to the patient, which may be different than other stakeholders' idea of value.
That's right. Yeah, that's a really important consideration.
I also wanted to add another example of some work that's being done in this space is the CIHR. They have a strategy for patient-oriented research, also known as SPORE. And I'm part of one of the initiatives, which is called Imagine. And yeah, it's patient-oriented research. They're involving patients in the research, asking for their feedback. There's patient committees within that. And then another thing I wanted to just quickly highlight, I'm obviously like fluffing my feathers here, but I'm a patient partner with Gastroenterology, which is the journal of the AGA. And they've included 2 patient partners on their editorial board, which I think is really cool. And they've said that it's one of the only journals who's doing this. Maybe there are a few others, but to actually have patients on their board to provide feedback on the studies, if they are including patients in the proper way, or if there's any patient feedback that can be provided. So I think that's really cool, and that's one area where patients are making a difference.
As patient-centric designers, what does that ideal patient-centric healthcare system look like to you?
The ideal, it would be just including patients without having to bat an eye. Like, like patients are already there. You're not even having to look for them. That would be the ideal outcome for all of this. Or just like have your patients before anything even starts. Have them on your boards, have them within your organization. They're part of your team. Don't look for them when you need them, because they're already there. That's what the ideal environment or space would look like.
Well, and maybe I'll just add on to that by saying that this utopia, Sabrina, that you've described, I think is really, dependent and rests on the belief and the premise that patients have equal voice and power in decision making related to their own health, where there is trust, where there is credibility, where there is belief in the value that people can direct and impact their own health outcomes and health journeys, and can request the services and the needs that they believe can benefit them. And so that's really, when I think about what kind of system do I want, it's one where I know the health outcomes that I am striving for as me, an individual, given all the social determinants of my own health. And I then can, through the system, seek out the expertise, the services, the diagnostics, the tools, the technologies that I think and believe will help me get there, and where I can seek trusted counsel and advice from healthcare providers that I trust and who trust me, that I can bring that circle that I choose into my decision-making framework.
Yeah, and
That's what I'm looking for.
That's like such an important lens to bring to the conversation too, because I mean, we could build like patient-centric policy, but it might only be appropriate for certain demographics within that patient population. So I think that that's a really important aspect to bring to that whole patient centricity discussion, is that it has to be patient-centric for all patients, for all populations, for all social determinants of health, regardless of the color of your skin, the amount of money you make, where you live. It really needs to be appropriate for everyone.
Yeah, everybody
And,
needs to be able to see
and
themselves within it.
that's right. And we have to recognize that the individuals have the expertise to determine what those outcomes for themselves are. So that's where I think the health literacy needs to focus, is how do we help individuals understand their own health outcomes and those that they can seek out actively, and then support them achieving those.
Yeah, and if I was a like a decision maker or like a politician and I was listening to this, I would be overwhelmed and I would be like, where do we even start?
Yeah.
Yeah, where do we even start? And I think that's a really good question because it can feel very overwhelming and intimidating. And I think that an action step or an item that you can take if you're listening to this is find a patient group or consultant like Unum Co that can help you make these decisions and guide you through the process. And I think that if you're an organization that wants to understand if you are patient centric, again, start researching, start looking into how you can better your organization. Um, but I did want to add one more action item is if you're a patient listening to this, feel empowered to use your voice, educate yourself on how you can use your voice, connect with other patients who are doing advocacy work, and see how you can get involved. Maybe you don't want to get involved on a high level, but you can advocate for yourself by just asking specific questions about your health to your doctor. So knowing that you have that right will just, all of these little steps will help change and shift the system. So we talked a lot today about what needs to be done, how we can work on changing the system, but we need to actually implement these little action items. So like I said, just start reading, educating yourself, and using your voice wherever you are in this system or whoever you are
Yeah.
in the system.
Yeah,
Yeah.
system change really can, like, it starts with people in the system, right? It
Yeah.
starts with all of us and our own mindsets.
Mm-hmm. Yeah.
Any final thoughts or statements or ideas that you want to throw out there on the whole topic of patient centricity, or maybe like a homework for people who are listening? If you're like in the life sciences or your patient advocacy group, like this is the one thing that you need to start doing for us to move towards this patient-centric utopia.
Well, I think one thing is to connect with people that aren't in your industry and to see how you can work together and collaborate, because we often see people working alone in their own boxes in this. And there's no change that's going to be made if we're doing this on our own. So reach out to somebody who's not in your industry and see how you can collaborate to make change.
Yeah. And I would add to that if you're an organization, and you're thinking about what it is that you're trying to achieve, really asking yourself the question of, are we doing this because this is the way we've always done things? Or are we doing this because we truly believe that this is the way that will help us achieve, our outcomes? It's really, a lot of people and organizations and companies get stuck in that this is the way we do it because we've always done it this way.
Mm-hmm.
And so how do we really challenge ourselves, to think about things differently?
Yeah.
But I appreciate the time that you guys have given me today, and I have no idea how long we've been talking, but I feel like it's been a while. And
Yeah. Thank you.
thank
Thanks
you
for
so
having the
much.
space and for having these conversations and
Yeah, we
for
really
having
appreciate
us.
it.
It's been great. And like you said, I don't know how long we've been speaking, but I feel like this is a conversation that could go on forever. It's
Yeah.
something we're all so passionate about.
Yeah, I agree. But I will make a stop now.
Okay. Thanks, Sabrina.
Thank you.
Thank you.